I'm Dr. Chad Farley. I'm a neurosurgeon here in Utah County. I practice primarily out of Mountain View Hospital in Payson, Timpanogos Hospital in Orem, and American Fork Hospital up in American Fork. Several patients have asked about artificial disc replacements in the cervical spine. Up until more recently, a lot of the data has been sort of a wash as far as whether or not it's beneficial. However, some of the more recent studies are coming out suggesting that artificial disc replacements provide a better alternative than the older cervical fusions. When we fuse people, we remove the normal motion that's occurring in their neck, and that's not really a normal biomechanical motion. We're meant to move, we're meant to look around, look up, down, to the sides, and when we perform these fusions, we take that away. And it's a good procedure, but an artificial disc is a good option in the right patient to preserve that motion, to minimize the risk of having other levels deteriorate, necessitating further surgery down the road. So artificial discs in the right patient can provide a really meaningful option for them to obtain relief of their symptoms and also avoid any further problems down the road with their neck. The artificial disc typically is used a little more heavily for younger people where they've got a long life ahead of them and they don't want to deal with further spine problems down the road. Although even in the older population, still preserving that motion in the cervical spine is still going to make a big difference. Those that have had extensive prior procedures in the past or have a condition called cervical kyphosis, where the neck bends in the sort of the wrong direction, may not be the right person to have an artificial disc placed. But nonetheless, it's usually the same person that might be getting a cervical fusion is good odds that they're also a good candidate to get that artificial disc placed as well.